All right, members, I see the commissioner has joined us as well as a number of counselors. So we will go ahead and get started for our weekly COVID-19 response committee meeting. I see we're already recording, so I thank our friends at Focus Springfield for their assistance today. And as always, this meeting will be available for the public to view following the recording this afternoon, available on Focus Springfield's YouTube page for Springfield municipal meetings. I'm City Councilor Jesse Letterman, Chairman of the COVID-19 Response Committee. We're joined today by Councilor Edwards from Ward 3, Councilor Gomez from Ward 1, and Councilor Allen from Ward 7. I also see our friends from Western Mass News and 22 News, as well as WAMC, are on the call, so we appreciate their coverage. I see the commissioners on the call. Commissioner, are you with us?
I am. I'm sorry, I am also on the, can you hear me?
Yes, ma'am.
I am also on the Black COVID-19 committee meeting at the same time. Their meeting started at 4. So I'm not on my camera events. I just wanted to let you know why you were just seeing my name.
That's quite all right. And I expect we'll have a brief meeting this afternoon, actually. I think folks just might have some questions on the announcement by the governor yesterday. So we can go right into that, Commissioner. I just wanted to say 2 quick things before we began with that report, which is relative to our meeting last week. I did reach out to the entire state delegation with the concerns that were raised in our conversation with Representative Williams with regard to the state and their efforts in terms of contracting outreach teams, as well as participating in marketing and media buys. So I'm hopeful that we'll hear back from some of the members of our delegation and that they can be of assistance in making sure that there's more proactive outreach by the state to yourself, Commissioner, and to the local officials around what that messaging is, and also around ensuring that the media outlets that they are utilizing are reaching a diverse cross-section of our constituency. So I'll keep folks posted on that. Hopefully we'll hear back from some members of the delegation. And also, I know all the counselors here are confirmed, and we sent out an announcement earlier today that next week we will not hold a regular weekly meeting because instead we will hold later on in the evening a virtual town hall, the purpose of which is to allow for members of the public, residents of the city of Springfield, and the business community to be able to give some input and testimony on how the pandemic has impacted them, and also how they think the city should be focusing on and especially leveraging incoming resources towards a strong and equitable recovery. So we're looking very forward to next week, and I appreciate, I know all 3 counselors that are here today are confirmed, as well as the commissioner, and a number of other, the majority of counselors will be joining us, as well as some other department heads. So we're looking forward to that. Commissioner, if you're able, I appreciate your juggling a couple of meetings today, and we all know how that is. If you're able, would you like to provide a brief update on your end? And I think especially, I'm wondering how you're feeling about the announcement by the governor yesterday and his reopening timeline, how you think that will apply, in your opinion, for the city of Springfield.
Well, thank you very much, and thank you for the invitation, Councilor Letterman. Again, I apologize. Got 2 computers going at once. So I think everyone knows the data that I give every week is up on the city's website, and you certainly can view that at your leisure. I'm sure if you heard the report from yesterday, you know that we had 154 cases. And we continue to see a downward trend in the city of Springfield as far as the positivity rate is concerned. However, our positivity rate is 3.85, which is 0.15 away from being back in the red. And so the city of Springfield still has some concern. I still have some concern for our residents as far as our positivity rate is concerned. However, we did have 154 cases last week, which continues to be down. I should say for Monday, there were 50 cases, which caused me, Sunday, there were 50 cases, which caused me a little bit of angst because 50 cases is 1/3 of all of the cases that we had last week. So I was very concerned about that. However, on Monday, it went down to 20, and today it is 18. So we continue to see, at least right now, the downward trend. The peak day for us for most weeks is Wednesday. So we'll see what tomorrow brings as far as positivity rate is concerned. We still have the 30 and under group that is comprising most of our cases, which is 60%, and then 25% for the 31 to 50. So we in the city, again, I just want to reiterate as I answer your question about the governor's guidance that I do reference the fact that the city still has a lot of community spread at this point. The basketball hoops started going up to yesterday, and we will have signs in all of the courts, even though the governor is lifting many of the restrictions, saying that we're still asking people to be mindful that there is community spread and we still are having COVID challenges. The city of Springfield in the last report fully vaccinated 39,739 residents, which is 25.4% of our residents. In Massachusetts, it is 3,050,054, which is 43.8%. So we do know that the Commonwealth is doing, we are still below the average for the Commonwealth as far as vaccination rates are concerned. Right now we are continuing to do the vaccinations at the Ray Jordan Center. Curative is doing J.C. Williams for us at this point. Thursday is still Ray Jordan, Friday Greenleaf and Greek Cultural, Saturday is Bolin, and this Saturday, we're doing the second doses at the St. John's Congregational Church for the faith community. We still continue to give Behavioral Health Network 300 doses every week. We are shifting our strategy from the large vaccination clinics, as most people are, Bay State and Mercy, and we will be going to sites. So we have a number of businesses who have requested us to come in and vaccinate their employees anywhere from 30 to 100. So our strategy will shift. We are hoping next week that we will begin the process of vaccinating Springfield Public Schools students. We are working on the consents now. We're also working with our vaccine provider to make sure that we are following all of the guidance. So next week, I anticipate we will be in the high schools working with Springfield Public Schools as well as our vaccine provider, which right now looks like it's going to be Curative. The reason we're going to use Curative is because they have experience with the Pfizer vaccine. They also have the freezers that we need at that coldest temperature. However, Curative has a policy in place that says that an adult has to be with the child in order for that child to be vaccinated. However, in the Commonwealth, our guidance says that as long as a consent is signed, that child can be vaccinated. So we are trying to reconcile the legal language at this time. However, whatever happens, if we need to go in with AMR, Springfield Public School nurses, the Department of Health and Human Services, that's what we will do. So that is where we are as far as vaccines are concerned. I talked with the Commonwealth, with State DPH this morning. They were clear that vaccination rates are down across the Commonwealth. And so smaller clinics is what is being advised right now. And so the information was, even if we have 30 people, 50 people, 60 people, let's vaccinate those individuals. So we will, again, shift strategies, go to smaller clinics, go where the people are. At Juneteenth, we will do a clinic in the morning for the brethren. And then that evening at the event at Court Square, we will do another vaccination clinic for individuals who are already there who want to get vaccinated. We will set that up in the atrium of City Hall. And then as people at any one of these events who want to be vaccinated, we will be there to vaccinate. In addition, there will be a movie that is going to be shown in Blount Park that Friday evening, the Friday before. and that will be starting at 3, I believe. And we will also at that time be handing out information and have individuals who, if they want to be vaccinated, there will be a flag raising at 10 o'clock Friday. I believe that's June 18th, or maybe it's June 17th, so that we can raise the Juneteenth flag. But our community health workers are going door to door and are reaching individuals one at a time, just trying to do that work. We believe all the people who want vaccinations know that they can get one in the larger vaccination sites and with our sites. The last thing I will talk about a little bit is lifting of the governor's guidance. Certainly across the Commonwealth, as you can see by the number of positive cases that are coming in across the Commonwealth, the cases are going down. So the Commonwealth felt as though they could lift the mask mandate, but there are certain situations that they are still recommending wearing face covers. People with comorbidities, people who are immune compromised. If you are in a nursing home, a long-term care facility, older adults and elder services, the recommendation is that we do keep face coverings. If you are in a setting where people are closely and tightly in, we would recommend that you keep on a face covering. The goal is people who are fully vaccinated do not have to wear face coverings. People who are unvaccinated should. But who knows who's unvaccinated and who's vaccinated? So what I am asking people to do is make an individual decision based on what you know about your health status and based on what you know about who is in your environment. The strategy from the governor's office is something obviously we will support. However, if the city of Springfield goes back to red, I will be advising that we make some differences in our recommendation around face covering. I will continue to wear mine when I'm uncomfortable. At the mayor's press conference yesterday, others took their masks off. I didn't. Only because in that environment, it's hard to know who's vaccinated and who's unvaccinated, as there are people coming in and out. There are those who felt comfortable doing that. I certainly felt as though I wanted to be a little bit more cautious. I will probably move towards that as time goes on. But again, wearing a face covering or a mask should be an individual decision, and people should not be shunned for keeping on a face covering if they are on a setting that they feel that they should wear one. I'll stop there, Mr. Chair, and just entertain any questions.
Thank you, Commissioner. Are there any questions for the Commissioner? Please feel free to jump in if you have one.
I have one. Excuse me.
Councilor Allen.
Sorry, I don't have my video on because I'm eating, but I'm here. So, Helen, you have all these daily clinics. That was a great roundup there of listing the clinics that are next week, et cetera. Is that the strategy? I mean, I know Eastfield Mall will continue, et cetera, but are you trying to do a clinic a day, at that pace? And what's the measuring stick? Is it until we just keep doing it, or do we keep, I'm not suggesting we don't do it, but I mean, is there a measuring stick as to how effective that is?
Yeah, I think, thank you. That's an excellent question. And so where do we get to where we feel as though we can pull back as far as some of our daily clinics are concerned? Right now, we will keep them standing up. However, I do see us scaling back on some of those clinics based on the foot traffic. All of our clinics now are open to walk-in, so anyone can walk in on any one of those dates, although we have the sign up on the city's website. You will see a press release go out that encourages individuals to walk in. So yes, we will keep them on site right now, even knowing that we will have less people. I just got a call from Dr. Scavron, who wants us to stand up a clinic at Brightwood for individuals who might be undocumented. There is some concern that there are questions being asked of individuals in other settings around IDs and health status indices and asking them to sign, asking them if they are a legal resident. Now, I haven't seen those questions, but he says they are on some of the form. So right now, because we're a city and that can vaccinate anyone, and we are encouraged to vaccinate anyone, right now our sites will all stay open in some form, even if we're only doing 30 to 40 immunizations.
Okay, thank you.
Thank you, Councilor Allen. Any other questions for the commissioner? Councilor Gomez.
Thank you, Mr. Chairman. Commissioner, when you mentioned that you will be able to vaccinate at this event that will be going on, did that include non-residents of the city?
We will not ask for identification. The state is allowing us to open up our vaccination clinics to anyone who works, lives, plays in the city of Springfield. And I think that that includes individuals who will be coming to these events. So to answer your question, yes, we can vaccinate those individuals. We will, however, make sure that they can come back for the second dose. Our traction with J&J, the one dose is not good. We tried to hold 2 clinics with J&J and it just did not have the participation we would like. So yes, we will vaccinate individuals who are at our events. We will consider them playing in the city of Springfield. And so we will move forward and vaccinate them, making sure they can come back for the second dose.
Thank you, Commissioner.
Thank you, Councilor Gomez. Any other questions for Commissioner Colton Harris? Seeing none, Commissioner, thank you very much.
Thank you.
And, I think that at this time we will adjourn, and I will look forward to seeing members for our virtual town hall next Tuesday. Please share with your constituents. All the information is on my page, but folks can very easily register via Focus Springfield. They've done a fantastic job, and we appreciate them helping us put that together. Also, anybody who may not be able to attend in person that would like to can certainly email testimony to myself or any of the counselors, and we'll make sure it gets shared with the body. So thank you all very much, and we'll see you all soon.